All right. Hey guys, this is Dr. Bailey. I wanted to get on do a quick video. I posted the other day just about some questions that people may have that maybe they just wanted some answers to. Could have been just about anything. Had some really good responses, and I wanted to just try to touch on them real quick in a quick video. Not take up any great amount of time there, but one of the very first questions somebody popped up on the screen there was discussing hemp protein and turmeric and some different benefits that, as a possible source of protein. And I'm a big believer in using hemp or any of the plant-based products. I'm not a big fan of soy-based protein, I can't lie. But hemp does typically provide nine of the essential amino acids that we need. So awesome example of a source of good protein without the increased inflammation we know that sometimes comes along with red meat and just general meat diets in particular. There was also discussion about curcumin. I use turmeric or curcumin a lot in cooking from the anti-inflammatory benefits. I've said it a lot. I'm a big believer in using as many things we can to help the body. Now we know that cannabis is an awesome option. It does a great job, but there's a lot of other natural spices and natural remedies that do a really good job of providing benefit of anti-inflammatory nature throughout the body, and the more we can do that, the better. Next big question was discussion of a coronavirus and marijuana use. It's a big topic right now. And the problem that I see with a lot of the articles, the CNN had a post, the New York Post had a big discussion about cannabis use and coronavirus and some of the issues associated with it. The problem that all of them are coming back to is they're comparing it to cigarettes. And when we come back and we look at the FDA, the NIH studies, we know that cigarette smoke has roughly 600 chemicals per cigarette in it. Cannabis just doesn't have that. And on top of that, when you compare nicotine to the various terpenoids or phenols or cannabinoids of cannabis, it's not even comparative. Now, the big discussion with a lot of those articles, that if you read them, it discusses how cannabis can increase your risk for infection because of the fact that it's anti-inflammatory, which again kind of goes against the whole it's dangerous thing. But when you really dig into it, what we're seeing is the profound, severe effects of coronavirus in a lot of cases, not all, because there's still a lot that we have to learn about this, but a lot of it's coming down to an overreactive immune system. So we're having a lot of times you hear people refer to cytokine storms. So they're getting this big ramped up immune response, but we know that cannabis actually helps dampen that. It's one of those issues that we try to look big picture wise. And if you really try to tunnel vision, it's not going to work. And so by decreasing inflammation and decreasing the immune response, it many times actually decreases the potency of we're hoping decrease the potency of coronavirus. And I can say a medical example of that is a lot of times we look at like rheumatoid patients. There's a long talk about Humira and Remicade and those types of things. Should we stop those in patients with coronavirus and actually, or because of fear of coronavirus, and they're actually saying no, they want you to continue those because of that same thought process, as it helps dampen some of that immune response that causes some damage to the normal healthy tissue, such as lung, parenchyma, and whatnot. So that's a big thing. And I'm actually going to do some more discussions on that topic probably on Monday with OK4U, one of the groups here in Oklahoma. Next big thing was cannabis versus tobacco use. Again, I kind of just hit on that. The cigarette produces roughly 7,000 chemicals when you combust it. So when you look at that and you actually look at the FDA will actually say, listen, that there's no real comparison there between cigarette and nicotine. It's not, or not cigarette nicotine and cannabis use and cigarette use and cannabis use. Big picture is the chemical compounds. Now, here is one thing I will say, and it's kind of cycle back to the discussion with coronavirus, is we know that there are times that, depending on temperature of vape pens or however you're using, if you can get some combustion, it can cause some minor bronchial irritation there. Cannabis itself is typically a bronchodilator, so typically, yes, it's going to provide some benefit, anti-inflammatory benefit to the lung parenchyma, but depending on type of combustion and type of inhalation, yeah, you could cause some irritation to the airways there and some mild inflammation paradoxically. So I can see how people that are at risk, if you have COPD, your advanced age, cardiovascular disease, diabetes, may be beneficial to possibly not use a high temperature form of combustion or inhalation uh, in regards to cannabis and coronavirus. Next big thing was, or next statement was talking about renewal process. So and this is, I'm going to discuss Oklahoma first. So in Oklahoma, the renewal process will start in August. The first licenses were granted the first week of September in 2018. So the state of Oklahoma will begin accepting renewals approximately 30 days prior to your expiration date. Now, what does that mean? You will need an updated recommendation form. You will not need an updated photo. What you will do is you will, once you obtain a new recommendation form, so for Evolved, you'll basically just go to the Evolved website and there will be a renewal option posted there. Click on that. Our renewals are going to be somewhere in the $40 to $45 range. Once you have your renewal recommendation, right, I'll have several people set up that can remotely help you upload your renewal to the state. Once it's uploaded to the state, it's a matter of waiting for your card. Now, it will be beneficial if you have the email access, password, and everything to your OMA account. So I strongly encourage folks to start looking into that to see what they can, if they have access to it. A lot of people that went to patient drives and stuff, they're not able to get into those things. So I would start to look at that. A new account can be created. We're working on that as well. So that'll be initially part of that process. Um, the last one was kind of a big one, and then I'll come over here and start looking at some of the questions or some of the comments. But autism treatment, especially in young folks, and how we're looking at cannabis or cannabis properties and cannabinoids. So, there's a lot of background research being done on autism, especially in cannabis. And what it comes down to is we know, looking at a lot of the different studies, that autism is affected by oxytocin and vasopressin. Not just those, but they do have a profound effect. And we're starting to see increased doses of oxytocin in our younger autistic spectrum disorders actually helps with emotional stability, emotional recognition, social cues, and those types of things. Interesting enough, CBD, Delta 9, THC, and CBG all have effects on certain receptors. I think it was it was TRPV2. But basically, what it does helps modulate oxytocin and vasopressin, either suppression or production. And we know that it is an anticonvulsant. We know I hate to use the term sedative, but it is somewhat calming, especially in the CBD realm, and CBD and CBG as well. So you get that calming method of treatment there without the side effect profile. So I think the big concern with pharmaceuticals in general, especially in the young population, is we're using fairly strong antipsychotic, a lot of time, medications on our young spectrum patients. And I don't know. I'm a big believer in medications at certain times. We need blood pressure meds periodically, diabetic meds. We can do a really good job with diabetes and blood pressure with cannabis, but there's time we need meds. My hospice patients, there's a lot of times that's there. But in our patients that are, preteen and still developing, and I really hate the idea of throwing them on a full strength antipsychotic medication without giving them a chance to see what we can do as naturally as possible. What we're looking at in the FDA and the DEA is trying to break down these big cohort studies. Terpenoids, terpenes are a huge thing, and a lot of people aren't aware. I mean, you can find terpenes in a lot of pine trees, coniferous plants put out a ton of terpene profiles. I'm not going to be somebody that's going to get in here and tell you that, hey, essential oils are going to cure cancer. I'm not going to do that. But on the flip side of it, we know that there's a lot of medicinal compounds that are derived from there, and they have a lot of really potent effects as being calming. The government patent on cannabis 6630507 is based on the fact that in their research they found that CBD was inherently a neuroprotective and a strong antioxidant for the nervous system. Those were kind of the big main points that people had asked for. I think there was like 40 or 45 different questions. Oh, let's see here. Let me get this pulled up over here, and we'll see if I can get um, into the last little bit here. And like I said, if you guys have any questions, by all means, hop on there, and I'll try to get some more stuff going. Dun, dun, dun. Hope everybody's having a good weekend. It's been got a lot of yard work done today. I'm not gonna lie. Okay, let's see here. Miss King, hey, how are you doing, ma'am? Hope everything's going well. Miss Brittany Cole, let's see here. Awesome, you've done well with turmeric. I'm really bad. I don't really do a certain dosage. I just add it to my food in the evenings, depending on what I'm cooking. If I'm cooking chicken or vegetables or whatever, usually anywhere from a gram or 1,000 milligrams to even 2,000 milligrams a day are going to be extremely healthy. I'm super excited to see that you've done well with Crohn's. I've had several patients come off of Remicade and Humira with some varieties of both edibles and inhaled versions of White Widow as a sativa-based hybrid. So we've seen some excellent response there. Chronic pain, migraines as well as also. Let's see here, Johnny. Let me see what your link is. Oh, yeah, there's a lot on both sides of that, Johnny. Let's see here. My pleasure, Miss Jennifer. Just trying. I think one of the big things in medicine, and this is just me kind of talking for a second, but what I like to, as doctors, I don't think we do a good enough job of just talking. I think that a lot of times the education helps. I think the more people know about things, I'll be the first to admit there's a ton of stuff that I don't know, and I'm not going to pretend to know, but I promise you I'm going to try to get out and look on both sides of the story and try to help as much as possible. I think one thing that I've seen is, unfortunately, I don't doctors aren't. I mean, doctors are just like lawyers, mechanics, plumbers, teachers. There's good ones, great ones, horrible ones. And unfortunately, I think some people or some docs in our country have looked at an opportunity to become viral with some of the stuff they put out. And I just want to make sure that we're as grounded as possible. I mean, here's the thing with Corona: is it a bad thing? Absolutely, it's a bad thing. Is it something that's killed a lot of folks? It has killed a lot of folks, and it's going to continue to be somewhat of an issue for a little while. On the flip side of it, I think you have to be cautious. I think there has to be limits or boundaries in how you go around managing and treating it. And I give you an example. Cigarette smoke. I'm the biggest anti-cigarette doctor in the entire world. Hate cigarettes. I can't tell you how many hospice patients I've held their hand as they died, and one of the last things, and I can't even imagine that your thought process, this is the last thing that goes to your mind, but last thing that goes to their mind is, and they tell me, man, I wish I quit smoking 25 years ago. And so, but I can't and I won't go around and tell everybody, hey, I'm going to take all your cigarettes away. I mean, I wish I could because it'd help you, but I'm not going to do that to you. And I think that that's what you're seeing in the general populace right now with folks that are kind of tired of being forced to do that. Um, do I get it? Yeah. I think the entire intent of the quarantine issue was to try and prevent our health systems from being overloaded. I think we've done that. We're really past the influenza stage. So I expect it to start opening. Here's what's going to happen. I can say right now, especially in the state of Oklahoma, we're going to have a spike in numbers, which we know not only because we're lifting 14, because testing is becoming more readily apparent, but we don't have a litmus yet from the governor or the mayors or anybody else on what number of spikeage before they start trying to retract services again. So that'll be something to be kind of interesting to see. There's just some really awesome research going on right now. There's a ton of topics. One thing I'm kind of curious about, and I'll put it out there. We see a huge. I mean, Italy got devastated. New York got devastated. They share a very similar genetic lineage there. There's some discussion about thalassemia and some blood disorders and puts you at higher risk. I think that's just one of the small little things that could be out there. I'm really curious. I follow it up daily, trying to talk to doctors in both New York and in Europe and kind of see what their thought processes are on it. Let's see. Johnny, you're absolutely right. The entourage effect of THC, CBD, and CBG does seem to have a profound effect on the nervous system. I think the only thing that gets kind of misconstrued, especially in the medical literature, is the what they consider the sedative or neurocognitive or psychotic effects of THC. And I think that's just verbiage looking at, the old school high that can sometimes come along with things. But on the flip side of it, I think we're going to learn more and more, especially as research opens up on what we can accomplish with that. Let's see, Brittany. Natural and certain chemistry. So Brittany, at least in my patient population so far, White Widow has done an exceptionally good job of treatment options for Crohn's. The thing you have to remember with cannabis is this: that yes, generally you're going to get some really great responses, but you have to remember it's based off of nutritional deficiency. It's based on your receptors, and your receptors are a little bit different than your neighbor's receptors, which are different than other receptors, but typically you can get similar responses. Now, there's going to be some varieties you're going to do a lot better for you, and it also depends on the location where your Crohn's is most severe. Is it distal GI tract? Is it proximal GI tract? I mean, there's a lot of different things that, as I'm sure you're aware with Crohn's, that it can affect. So that'll be something that'll take a little bit of trial and error, but at least so far in my patient population, White Widow's done really well for several patients. Johnny Harrington, 1993 patent for AIDS, cancer cure, silver, tetroxide, influence being used today. Not that I've seen. Now, the problem when you looked at the silver components back in the 90s, you were starting to get some toxicity with it. Now, silver is awesome, and we use it all the time as an antimicrobial and whatnot. There's a lot of research going on in using actually the activated AIDS virus for treatment, and it's the way the AIDS virus actually works. And AIDS actually, or HIV, or formerly, I guess, works very similar to coronavirus. Um, it's an RNA virus. So basically, what it does is it uses our body cells to replicate. It has to take over that cell, use the machinery inside the cell to make little babies, and then disperse out into the world. So from that standpoint, there's a lot of thought processes on you can maybe use certain types to treat other things. So like for cancer, since you hit on that in there, they're looking at using, and they have been used, or at least in a couple different studies, using HIV, deactivated HIV particles to inject almost like chemotherapeutic agents into cancer cells. Elizabeth Ann, renewals on license. So renewals are going to be somewhere in the $40, $45 range. Working on that, trying to figure out where we need to be at just to make sure our practice and stuff's covered. But the renewals are not a very overly complicated process, especially if you got your license from us in the first place. One of the things that I try to talk about is especially with myself, you're going to get stuff like this. But if you're my patient, I give you access to me at almost all times. As far as if you ever need a letter for work, you need a letter for school, you just have a question about cannabis or medications or whatever it may be, you can message me directly through the Evolve page. You're going to get a response from me. So I try to make sure that I'm pretty readily available. Let's see, that's me in America, calls house back, someone's meds. That's awesome. And see, that's usually that response, Brittany, is what happens from doctors when we don't have a good answer as to why something happened. And I use that answer a lot of times with cancer patients because I have had so many stage 4 cancers do exceptionally well. I tell all my patients that I'll never tell someone that cannabis cures cancer, but I'll never tell someone that cannabis does not cure cancer. There's just so much we don't know, but I love it as another tool in the tool shed, and we can use it as an aggressive form of therapy. All right, Steve. Already had it. What is the immunity time before or if reinfection? No one knows. That is the big problem that we're running into right now. And so we're looking at these antibody tests. And actually, Dr. Shrum did a really good job on one of the news conferences the other day. I was trying to watch in between patients, and she talked about the fact that, hey, these antibody tests that we're doing, they're showing us, yes, we've had prior exposure, But one of the things that we do not know, and we will not know for 6 to 9 months on the road, is these antibodies that we're producing, are they protective? Is IgG and IgM, I mean, IgM showing us, yes, acute, relatively acute infection, IgG is long term, but there's a bunch of different viruses and infections that you can develop IgM and IgG antibodies to and still catch it again 8 months down the road or 6 weeks down the road, just depending on that certain infection. So that's a big topic right now in trying to determine tracings for contact and all of that. Let's see. Brittany, yes. Don't forget the topicals. The topicals do exceptionally well also in treating. And I love the idea of combining topicals with edibles and the other forms. There's several places that are offering it, Steve. Let me ask around. The problem is, depends on if it's DEA and FDA approved or not. I'll see you're over in Chicago. Let me see what I can find out, Steve. I've got my other Facebook page. I'll try to, I think I've got you on that one. I'll try to add, see if I can't hit some people up and find out about the actual source. I suspect, and this is another thing that's going to come around, is I know several people personally that were ill, and a lot of us were, had cough and no fever, but persistent cough and just felt kind of crummy in November, December. Now, this is another big thing about tracing a virus in a world that travels, and especially the world when you talk about how many thousands of airplanes leave out of some of the major airports every single day in the United States. Whew. So we've had several. Like I said, I have several close family friends that were ill, or I know of personally that were ill in like December, and they just recently tested positive for antibodies, and with no illness since then. Now, does that mean that they were sick back then? No. Could they be asymptomatic carriers? Yes. That is the biggest issue. Trying to figure out what to do with all these positive tests is try to figure out, hey, they're positive. Are they a carrier? Are they a previous infection? What does that mean? What is it going to do? I think that individually we just need to sit down and look at it. Hey, how are we doing with, are we at risk? Are you at risk? Am I at risk? I can tell you that I go out. I'm pretty cognizantly aware of where I am and who I'm around. I maintain that social distance aspect. The only time I wear a mask currently is on my hospice visits, nursing home visits, or if I'm going to be acutely close to somebody that I feel is an at-risk individual, just in case. I don't want to have that on my conscience, and as a medical provider, I think that that's good stewardship. If I am going to go out, I typically go out. I'm not going to lie, I get up about 4:30 every morning anyway, so I get up and go about 6 o'clock in the morning and get most of my errands run if I want to be out and about. Otherwise, I'm here, or like I said, I'm out treating patients, and then I do have my N95 and my gloves and stuff. So that's just kind of for me personally. Hey, Aaron, man, glad to see everything's going all right, brother. Good old Independence, Kansas. Let's see here, and then Steve. Let me, like I said, Steve, I'll find out. It very well could be. Now, the thing you got to remember is, what are you going to do with that information? It's one of those things that uh, um, if you're ill or have any issues with possibly being ill, just be cautious who you're around. I try to, especially the younger guys I'm around, either in the gym or military or whoever it may be, try to encourage them. Hey, it's not just you. Just be cognizant of who you're going to be around. Little ones are not really affected right now. We know that they're doing it for a multitude of reasons that are under research, but um, it's your older population, your diabetics, your coronary disease, your cigarette smokers, guys. That's a big one. Like I said, I hate cigarettes. I hate them, hate them, hate them. Smoke cannabis till you're blue in the face. But on the flip side of it, it's going to be something you just have to be cognizantly aware of who you're around. I will say, like every time I do go to Lowe's, if I run into folks, they're usually a little bit older, and they have done a lot better lately of wearing masks and doing those things, and I think that's good. To be considered high risk, you have to be within 6 feet of an individual for 15 minutes that's actively infected. So that's something to kind of keep in the back of your mind as well. So, yeah, I think that's leafy words from my other minds. Now, here's the thing, Steve. If she's already had the same thing, I wouldn't stress about it too awful much. I would tell her to continue to be cautious, cognizant of who she's around, and if she's out and about and washing hands. That is the biggest thing, guys. Wash hands. It kills this virus really easily. Um, yeah, and I'll dig into it, see if I can't find any antibody tests. But I promised I wouldn't make this one super awful long, but I'm going to try to do this weekly, every few days, something like that. It just depends on what people need and want to hear. I'm going to try to do one for the Arkansas pages as well. I'm licensed in both Oklahoma and Arkansas, so I'd like to try to address everybody. But if there's anything that you guys are ever curious about, you guys can always message the Evolved Health and Wellness page. You can post on the page. There's a lot of different interaction ways there, or you can go to the website as well. I'll be glad to, like I said, individually address anybody I can. All right, y'all have a blessed weekend. Talk to you soon.